Okay, welcome back again, everybody, to our next Facebook Live. So happy Friday. Once again, I'm Stacy Longnecker, and I've got Dr. Al Ross with me again today. And we are just going to do the same thing that we've been doing. So we'll start with just local stuff. Again, I mean, we are still kind of seeing numbers a little higher than they had previously been before, but I'd say probably pretty consistent in the last week or two. I think Big Stone County active cases right now are 16. Um, and looking at the vaccine numbers as far as percentages of vaccine right now in Big Stone County, it looks like 25% of our county has gotten at least one dose of the COVID-19 vaccine. So that's just kind of where our local numbers are. At the hospital, we are still doing that BAM monoclonal antibody infusion. So I know there's been a couple of people at least that have gotten that in the last week as well. I don't know of any, new hospitalizations as far as COVID goes. I feel like things are just kind of staying pretty consistent. Anything that you want to update there?
No, I just a one little blurb is that Big Stone County was ranked third in the number of people they vaccinated over age 65. So proud that both us and Graceville have been able to achieve that ranking in the state. And as we talked about before, there's a lot of behind the ground, behind the works that go on to get the people the shots under their shoulders. And so, yeah, kudos to them.
Yeah, absolutely. I think so. We've got a few things just kind of on our list, questions or topics that have come up for us in the last week that we'll, kind of get to too, I think. But first, I'm sure a lot of what people are wondering about is, vaccine status here. So we have found out that we are not going to get any vaccine next week for first dose administration. So, and I just want to clarify that too, because last week I didn't clarify that when I said we weren't getting any vaccine for the following week. What I mean is any new doses of vaccine for new people. We are still have been told that we will be getting the second doses. So if someone has gotten their first dose here, we should still be getting those second doses whatever date you've been told, we will still be getting the second doses for you. But what I'm talking about is getting those new first doses. And so this past week, we did not get any vaccine, and we have found out that we are not getting any for next week either. And obviously this is frustrating for us. This is not the answer that we were wanting, but we will not be getting any new doses for next week.
Yeah,
yeah, go ahead.
Maybe to clarify that, because a question did come in in the last week about, why was Appleton and Madison vaccinating this week and we weren't? And it's a very, very good question. And the way the distribution system works is that we're part of a coalition in southwestern Minnesota, and every week the state gets X amount of vaccine that they distribute amongst those coalitions, and so it comes into the coalition, and we have to submit how many people do we have left that's on our roster above age 65 that still need to be vaccinated? And they look upon that and they see where, okay, this clinic needs to catch up or this clinic needs to catch up, and they're trying to level it as much as possible. And so this week, Appleton and Madison received vaccine, and we get that list. We know exactly, it's transparent to every clinic and hospital in that coalition, and so they just happened to get their vaccine, and we didn't. But 2 weeks ago, we got a substantial number of vaccines. So it really depends, like we've been talking about, on a week-to-week basis, what the state says that we get. And it sounds like with the winter storms that have been ravaging the other parts of the country, that's put a delay on our the shipments that have been coming to the state of Minnesota, and perhaps that's why maybe we're going to get less vaccine over this next week. Hopefully there'll be a catch up with that.
Great explanation, great point. And I know I've heard some questions about that too from patients who have people that they know that live in other areas that maybe got a call to get their vaccine. And that person may be, younger than somebody in Big Stone County who hasn't gotten called, or, that sort of thing. And, we understand that that's happening in different places because people are, it's different numbers of people in that age group in that distribution. And so there may be people in other areas that are getting vaccinated before somebody that would be here. And obviously, we can't do anything about that. So we are still just obviously getting the vaccine out as quickly as we get it here. And that's the best that we can do. And I know that it's very frustrating. So we are going to keep working toward that. Just a couple of things to say, and correct me if I'm wrong on any of this stuff, but my understanding is that right now, we also just want to kind of let people know if you are 75 years of age and older, and you consider yourself an OAHS patient and you have not gotten a call about the vaccine, then we want you to call us. If you think, like I said, if you're 75 and older and you feel like you should have been called to get your vaccine, and you haven't, then we want you to call us so we can let you know. If you are 65 years of age and older and you have not been seen at OAHS in the last 3 years, you will not come up on our list to give you vaccine. And so we do also want you to let us know if you feel like you are an OAHS patient, but you haven't been here in the last 3 years, you won't show up on that computer generated list that we get. So we also want you to let us know. If you're 65 years and older and you are an OAHS patient and you have been seen here in the last 3 years, you will be on the list, so that when we get vaccine, we can start making those phone calls. Anything that you want to update to that?
No, I think part of that information, I think right now we've identified 698 individuals over the age of 65 that we have left. And so that's kind of the ballpark number we have. And again, that probably will be added to that number because there'll probably be people that live in Big Stone County. We know that South Dakota's been telling, so let's say there's somebody who lives in Big Stone County that goes to a Vera Milbank to seek their care there. Vera has told them, and South Dakota has told them that they are not vaccinating Minnesota residents. So that number probably will change a little bit because I'm assuming there's going to be a number of people that will get the vaccine here that just aren't on our list yet. So, but at least it gives you kind of a ballpark of where we're at.
Yep, and same thing that we've said before. If you are on, a list through public health, or you are on a South Dakota list and you get called from them before here, go get your vaccine. Mm-hmm. So, and I know, there's other information out there about, trying to sign up and get on lists and kind of lottery systems and things. And certainly we would encourage any of those things that people find, to look into. So, I think that was just a comment maybe that came through.
Roland Hebnit, thanks. I'm on the list, hopefully. Yes. Yeah.
Okay. Just one other quick thing to say. I had a question or a comment just asking us, actually, Dr. Al, about whether we could share these videos or be on another platform besides Facebook for anybody who doesn't maybe use or have a Facebook account. And so I had talked with John Rogers, and we are working on that. We're going to work on getting these videos, if not live. Today's obviously is not going to be on any other platform live, but we're looking at recording them and getting them on maybe like a YouTube platform. So we will be letting people know if that happens, and certainly get the word out. If you're on Facebook and people that maybe aren't, that want to see them, then we'll make those available too. So
maybe this is an opportunity to give a shout out to John Rogers for all his hard work with this, because this is yeah, that's right. You guys can't see John, but we see his image in the background, and he kind of rolled his eyes. But really, I mean, we appreciate the nice compliments and all the great questions from everybody. But without John, Stacy, you and I would not be here, because I don't have the time nor the knowledge how to do this. And I don't know, maybe you do, but
not new.
And so thanks, John. I mean, kudos to, helping out in this mission and getting this information out. And we appreciate that. And we know that the people that are watching really appreciate it. And you don't get your laurels. So thanks and kudos to you.
Yes, absolutely. Thanks, John. So just as a little side note, so I'm not techie at all. And actually my 5-year-old changed my mouse on my computer at home, the arrow, and it's just huge. Like it takes up half the screen, just the arrow of the mouse. And I could not figure out how to change it and I couldn't do anything. So I'd have one of my other kids come and fix it for me because I had no idea what I was doing. So there's no way I could do anything like this without a lot of help. So let's just see if had something else come through here. Okay, so I'm seeing from Jeannie Canton. It says, if you were not able to get the vaccine when called, temporarily out of state, what is the process to get on the list when we return to the state? Do you know that? Are they supposed to call again, or are they kept on the list, or how does that work?
I believe that if we call and somebody answers and they say, no, I'm gonna be out, they'll keep them on the list to call next time. But if it's a call, nobody answers and you come back from, your vacation and you get a message or something, or you see that you get a call from Ortonville Area Health Services, then yeah, I would encourage you to call back and just to make sure, because we're happy we've got the list now. And Liz Sorensen is going to distribute that to the people. So if you call in, they can look up and say, yep, you're on the list there too. So that's that. And Jeannie, that's what I'd recommend if we called and you never picked up, but you saw it was a call from us.
All right. Another thing just to bring up, just to make sure that people are aware, there have been new recommendations that have come out for women as far as mammography, so getting mammograms. So I want to explain that a little bit too, related to the COVID vaccine. So they're recommending right now that if you are due for your routine mammogram, that you get that done either one day prior or 2 to 3 weeks after your last dose of COVID vaccine. And the reason is because there have been some situations where women have had swollen lymph nodes after getting the COVID vaccine. And that can, certainly make it a little bit difficult to determine on a mammogram. I mean, not that it's difficult to see that, but it can make you have a swollen lymph node on a mammogram that you wouldn't have otherwise had. And then that could then in turn cause some follow-up things to come out of that. And so because we know that that is a risk, then we're just saying just best not to do your mammogram during that time period of getting the vaccine. And also just as some education to let women know that we are seeing that. Because if you would notice a swollen lymph node, of course, that's always something that we would want you to be notifying of us of, historically. But in relation to the COVID vaccine, it is happening, and we've seen it several times in women. So anything else that you want to say about that?
No, perfectly said.
Okay, and it will go away, it will resolve, it's just a reaction, it's just an immune reaction. It's not anything to be worried about in that setting, so.
I've got a clarification from last week. We talked about that if you received your two-part series, if you have exposure, do you have to quarantine? And in fact, you asked the question, well, does that mean right after my second dose, or is it a 2-week wait? And I went to, that was new information last Thursday, hours before we went on Facebook Live. And CDC did clarify that it's a 2-week wait after your last week. So you've got a window from 2 weeks after your last vaccine up to 90 days. That if you have exposure and if you completed your 2 series vaccine, then you don't have to quarantine. Again, that applies to the general population, does not apply to healthcare workers. So, but just wanted to clarify that since we found out some new information from last week.
Okay, perfect, sounds good. And then actually along those lines, I had someone ask me a little bit about, and we've talked about this too, post-vaccine guidelines as far as activity and things. And if people, can start to feel more comfortable, obviously, 2 weeks after their vaccine with things that they're doing. And again, just to reiterate what I would tell people and what I'm, doing myself, I'm still, social distancing, wearing my mask, doing all of those things. Now, I think obviously the goal and the hope is that, yes, we can start to do more things after being vaccinated. if there are things that you feel like you've really been not doing, like not going to the store and not doing things like that, but you can still do those things with the guidelines in place, like wearing your mask and staying 6 feet away, then yes, absolutely start doing some of those things for sure. But I wouldn't say that we should start doing things that go outside of, the masking and social distancing guidelines. That, I guess that would be kind of what I would say to that. And we're all hoping that that's going to happen as more and more people are getting their vaccine, and we're starting to hopefully see some community immunity too. Like, this is the goal and this is what we want, but we're just not there yet.
Yeah. There's some interesting data out of Israel, which Israel is the nation that has about 9 million people. A little over 6 million have had at least one vaccine, and about half their population has received 2 vaccines. And so in a microcosm, if you can say one nation is a microcosm, but compared to the rest of the world, we're looking at that, and it looks like they're seeing less transmission of this virus. And again, I think as we study that and get more information, Dr. Stacy, that hopefully that'll drive some of our protocols as far as, can we start to loosen up our restrictions, and that'll be pretty exciting data, hopefully, to come down the line.
Yes, I agree completely. I don't think I haven't really had any other questions. Go ahead.
So what are your thoughts on the COVID booster shots they were talking about in the news? So yeah, I read an article a couple of weeks ago about that Moderna, and with some of the variants, they may be looking at providing a booster to provide better immunity against some of the variants. And I think that information is just very prelim, and they're looking at providing a booster, but I don't have anything more concrete than that. Do you, Dr. Stacy, that you've read?
No, I haven't seen anything about it. So it's not like a third dose of the same vaccine. It's like an altered vaccine that would be a booster.
That would be my understanding. Yes.
Okay.
Yeah.
Okay. No, I haven't seen anything on that.
In regards to the Pfizer vaccine, there was an article in Lancet that's preliminary that says that perhaps one shot, provides up to 85% immunity after about a month. And so they're looking at maybe doing a shot and then delaying a booster by like 3 or 4 months to try in an attempt to immunize more people, so they don't have to have that reserve for the second shot 21 days later. And also another exciting information is that that it didn't require the deep freeze, the ultra deep freeze, that it could be frozen or transported in a regular freezer. And so there might be more information on that, which will help distribution. Doesn't really help. We still get kind of really funneled as far as once we open that vial, we have 5 to 6 hours to vaccinate people, and that's really the tough part. Unless we can pull that vaccine off the shelf and it can sit there for a while, that's going to make scheduling people for a vaccine a lot easier. But just a little information since you were talking about the Moderna vaccine.
Yeah, good.
So
nope.
I got one question for you, Dr. Stacy. So you have an article in the Legacy. I recommend anybody to read that. It's an excellent article. Stacy has an article about the diary of COVID this past year, and the Legacy is a publication that's put out by the foundation, the Big Stone County Healthcare Foundation, and Vanessa and John do an excellent job of putting that together. But you had an interesting point about kids in the COVID era, the pandemic. And the social distancing thing about hugging and being close to the kids, and maybe you want to share your perspective on that.
Yeah, sure. So in my kind of the way that I had written it in that article, or what I was talking about, of course, was obviously early on, in the pandemic, when we just weren't sure how long this was living on surfaces, how long it was living in general. We just so much uncertainty and all of that. And it was just more along the lines of, being afraid to bring this home to my family, and, my older kids who understood what was going on, being afraid to be close to me at all, like that sort of thing. And then in turn, my younger kids who, didn't have any hesitancy, I guess, about, that closeness with me or whatever, because they didn't know what was going on, but then me feeling hesitant about being that way to them, and it was just this very interesting feeling for me at the time. And in general, I'm not a super big hugger. I'm more of an introvert type person, which is why a lot of this stuff is totally outside my box, but I'm coming around. But anyway, but at home, I mean, I'm very much a hugger with my kids. And so it just felt very sad to me at the time. But anyway, in general, kind of since then, I think that's another thing that I've kind of made jokes, like I wasn't a real big hugger before COVID, but I feel like after COVID, I'm really going to be, because I feel like once you kind of recognize what you're missing, it's really kind of sad. I mean, there are a lot of benefits to being able to, be close to people, and hugging is just super important, I feel like. And so I have felt that a lot. And the other area that I feel like I've really noticed that with is, patients, not that I'm hugging all of my patients every day or anything, but patients that I really feel like could use a hug. And then I feel like I'm in a situation now where I shouldn't, or especially like my babies that I'm seeing back after delivery. I used to just come into the room and pick up those babies and hold them during the appointment. I'm hesitant about doing that now, just because I don't want to obviously ever put anybody at risk. And so I think it's just a lot of things that I think about related to that. And how do we, I don't have an answer for this. I'll ask you, how do we keep our kids without putting those barriers up during this time, especially kids that are growing up in this time right now? And I don't know I don't know. It's very interesting, and it's kind of sad, I feel like, to me.
I think that's an excellent point. And actually, after reading that article, I went home last night and I commented to Taylor, who was a junior in high school. I'm like, Taylor, you just don't hug me like you used to. And maybe it's just a teenage thing. And that's fine. I get that. But I think maybe we need to make a conscious effort to make sure that we kind of deprogram our kids, because I think there has been some of that. I think you're right that we've all learned to social distance. I mean, stay away, and maybe as we come out of this pandemic, and maybe we just need to do more of that, especially at home with our own family, and then eventually with others. And so maybe just not to forget the art of hugging.
Yeah, I agree with that completely. And like I said, I feel again like I didn't really realize how, I don't know, how important it was until I wasn't doing it as much anymore. So I think that's a really, really good point. And in general, even, you bring up the point of having conscious, intentional conversations with our kids about this stuff. I think that's really important, because we don't even know sometimes what they're thinking about this or how they're feeling about this.
Yeah.
And just being able to even ask them, how are you feeling about this? Or what do you think about this? Because we might not even know the things that they're thinking until we ask. And then they don't always know how to put it into words either. So yeah, it's just been so different, and hard to work through. So I don't know. But yeah, on another note, with that legacy, I agree. Great job to everybody who put that out. And Dr. Al, I really liked what you wrote as well. I think it was a really good addition. And also, on another note, the Stork review, like, how funny was the front page of the Stork review? So I thought that was really, really funny. That was a great picture, that baby. Did you see that, Al?
Mm-hmm. Yeah. That's great.
That was fun. So, yeah. Anything else you can think of that you wanted to talk about?
No, I think that looking at my list, that's what I had on my list.
Yeah, I don't have anything else either, and it doesn't sound like there's any other questions coming through. I'll maybe just do, and we might have done this last week, but I know there's been more positives. There's been, obviously a situation at our school right now with preschool, not to get into any details on that, but just to kind of recap what we're talking about as far as exposure and things. So current guidelines, if someone has been exposed to COVID-19, meaning a high risk exposure within that time frame of someone being positive, the general quarantine or isolation guidelines. So if you have tested positive, it's still kind of that 10 days. So 10 days from symptom onset, or if you're asymptomatic, it's 10 days from your positive test that you are considered contagious. If you are in quarantine from an exposure, then right now, if you're not a household contact of that exposure, the recommendation is for a 10-day quarantine instead of 14. Or you can opt to do a 7-day quarantine as long as you have a negative test somewhere between day 5 and day 7 of that quarantine. So that is the guideline right now. But the household contact is still 14 days. So 14 days from last exposure to a contagious person. Now, I did also learn that, so with a household contact, if you have the ability at your home to be completely separated, so if you have, someone within that home that can be separated from everybody else in quarantine, so you're not using the same kitchen, eating area, you're not using the same bathroom, and you're not within 6 feet, then you could potentially, not have to quarantine. If somebody in your household would test positive, but the other person has been completely separate from that person. So that is something else that I had learned that I thought was interesting. Of course, that's very difficult to do, within households, but there is an option of that. So, and then still, as far as testing here, we are doing in-house testing and send out testing. And just to reiterate again, because this continues to come up a little bit, the in-house test is really only considered an accurate test in somebody who is having symptoms. So if you call and you are asymptomatic but exposed and you're wanting to be tested, and you are told that you can't have the in-house test or the rapid test, the reason is because it's not considered accurate. It's not because we, don't want to do it or because we don't think it's important enough. It's because it's not considered the accurate test in that situation. So just to reiterate that. Thoughts on that or anything else to update there?
No, nothing to update there.
Okay. Did something else come through? Did you see?
Rich Thurston, you guys covered everything I was going to ask. So, hey, how about that? Rich, no homework for us this week, I guess, huh?
Very good.
So.
Okay, and nothing else coming through? Okay, so we will go ahead and sign off for this week, and we'll let you guys know next week. I think we'll probably try to keep doing it toward the end of the week. That way we can let people know, because usually we're finding out like Thursday, Friday-ish if we're going to get vaccine for the following week. So we'll continue to do that. Any questions come up in the meantime, let us know. Okay, have a good weekend, everybody. Take care.